This lecture is going to cover environmental health and toxicology. In this unit, we'll connect how environmental hazards from chemicals to radiations to pathogens affect human health and ecosystems. First, we'll define toxicology and the dose response idea. Then we'll look at environmental justice and how exposure is unevenly distributed across communities. We'll discuss how toxins are tested and monitored, examine pollution and infectious disease patterns, cover radiation risks, and explore cases such as Tampa Bay, Flint, Michigan, Love Canal, and PFAS. And we'll end with bioremediation solutions. Toxicology studies how chemicals affect living systems. The key idea is dose response. As a dose increases, the severity or probability of the effect increases. Most substances have what's called a threshold, a lowest dose where the effect is first observed. This is kind of like that classic saying, the dose makes the poison. Even water can be toxic at extreme doses. Exposure routes for toxins can include ingestion, inhalation, and skin contact. When we look at this graph comparing the dose by the percentage of people affected by that dose, we see a blue line and a red line. The blue line shows the therapeutic effects. This has a relatively small dose, and we want to look at where the therapeutic effect starts to wear off. So as we increase that dose, we start to notice when we get towards like 100%, it starts to level off. We do the same thing with the dose for a toxic effect. When we look at this image, we see that the higher doses have a more toxic effect than those therapeutic ones. So what we do is we look at the therapeutic index. So the level at which 50% of the people are benefiting, but 50% are also toxic. So this is called the therapeutic index. We want to find solutions somewhere within that range because we want to be able to benefit by having a medication for people, but we don't want it to be at such a high dose that it's going to be toxic. So we find this nice little area in between, and that's where we start with the therapeutic doses. Now, sometimes the dosage may shift up or it may shift down depending on the patient. If someone's not responding well, then obviously they don't want to keep them at those higher doses, so they might reduce it. But they also want to keep it above that level where it's going to be therapeutic for them. Environmental justice means fair treatment and meaningful involvement of all people in the environmental policy. In practice, many marginalized communities live close to highways or industry and waste sites, and they face limited political voices and healthcare access. Thus, they experience higher exposure to air pollution, lead, and contaminated water. Environmental justice pushes for equal protection and clean resources for everyone. So not just the people that can afford it or the people who can afford to live in households in better areas, but also for those people that are underrepresented. PFAS are kind of a hot topic right now. These are also known as forever chemicals, and they were used in nonstick cookware, firefighting foam, and waterproofing. They persist in the environment and in our bodies. Population biomonitoring has shown widespread detection in the blood, and health concerns include cancer, immune, and liver effects. PFAS contamination appears in many U.S. water systems, with regulations involving slow progress, making PFAS kind of a prime example of how chemistry, policy, and public health interests intersect. One thing to notice from this graph, we have a couple of different colors here. We have PFOS, PFOA, PFHXS, PFNA. These are all forms of PFAS. You'll notice over time, probably the biggest offender here is the PFOS. It has like a geometric mean blood PFA level of 30. So that's going to be micrograms per liter. The others stay around 5 micrograms per liter, a little less on some of them, but you'll notice over time they start to decline. And it's gotten to the point now where the PFAS found in the blood is at or below 5 micrograms per liter. So what caused this decline? Well, the EPA decided that it was going to phase out production, so stop letting companies produce products that cause PFAS, and they began reducing emissions that led to PFAS being released into the environment. So this is a good example of how regulations are supposed to work. If you identify something that's causing harm, regulations should be put into place to reduce that harm. Next, we're going to look at laboratory testing. The first one is in vitro. This means in glass, and it describes the utensils that were historically used for testing. This included things like test tubes, and today we use cell cultures. What these do is expose a small amount of toxin to specific types of cells. And we look for things like cell death or damage to the DNA or even hormone disruptions. And the hormone disruptions are tested using what's called an endocrine assay. So an assay is a type of test. And the endocrine system is the system that regulates our hormones throughout our body. So if we have a disruption in hormones, it can cause a number of problems depending on the target area for those hormones. In vivo means in life, and these are tests conducted on living organisms such as mice, rats, fish, or frogs. They're exposed to a toxin, and we're looking mainly for acute and chronic toxicity. So acute toxicity means short term. And one metric they use to measure this is what's called LD50. And that is the dose that kills 50% of the test subjects. If it kills 50%, we know that's too high of a dose to be exposed to, and we can confirm that that is in fact a toxic substance. Chronic toxicity is the long-term exposure to low doses. So in this case, let's say we're testing how a pesticide affects livers in rats over 6 months. They would expose them to a very small amount of that pesticide. It could be in like contaminated water, which would be a more kind of realistic scenario if we're applying it to the human population. And they would measure how it affects the liver after that period of time. So 6 months is usually a good indicator for long-term effects. That's kind of like anything before that is more on the acute side. Anything above 6 months could be considered long-term. We also look for reproductive and developmental toxicity. So this can affect the growth of the embryo, the fetus, and it can also cause developmental problems throughout a child's life. It can even cause miscarriages and death, which can be very detrimental and traumatizing for families. Beyond labs, we sample air, water, soil, and tissue to see what's actually out in the environment. We track bioaccumulation, which is the buildup of those toxins within an organism or multiple organisms. And we track biomagnification, which is the increasing concentration up the food webs. And we monitor ecosystem health indicators, such as if we were to see a mass die off of fish, or increasing stress on plants, or lower diversity. these are examples of where we might see uh, kind of red flags to indicate that the ecosystem has a health issue. So if we start noticing things like this, one example of what we could do is if we were to see a mass die off a fish, we could test for things like mercury in those fish populations and see if they do contain high amounts. And if they do, policymakers can put out advisory consumption safety protocols. This is currently happening in my area. The retention ponds that have a lot of fish, they have not started dying off, but they have tested them and indicated that there are high mercury levels within those freshwater fish. So Hillsborough County has indicated that there is an advisory in those areas, and people are not to consume any fish that they catch if they're out fishing. I will say that these are not always done in a way that makes it to the public directly. Usually these are posted on government websites. There may be a news article about it, but sometimes these notifications do not reach the public, and that's a gap in policy. So this is kind of where the science meets the policy to keep the populations safe and prevent some of that toxic exposure from getting into humans. We also have chemical analysis and computational models. Chemical analysis are ways to quantify toxins. And these can include things like PCBs, PFAS, lead, and other samples that we don't have a lot of data for. Some methods that we can use are gas chromatography, mass spectrometry, and high performance liquid chromatography. I will say these do have some limitations when it comes to certain compounds. Science Versus did a really good podcast episode on if there's really a plastic spoon in your brain, and it did bring up a study that showed some limitations in the testing methods for the gas chromatography. So if you have some time, it'd probably be interesting to give that a listen. I have posted that in the supplemental learning materials for this week. We also have computational models. This uses known data to estimate the effects of these untested chemicals. So we can use things like quantitative structure activity relationship models or physiological based pharmacokinetic models. You're not going to be expected to know what these are, but if you're interested in learning more about this topic, you can definitely look up more information on your own. And if you do plan on going into toxicology, you probably will be working a lot with these. So if you can get the opportunity to work with some of these methods earlier on, it would be a great thing to put on your resume. So taking a look at regulatory guidelines and risk assessments, the guidelines are set by agencies like the U.S. Environmental Protection Agency and the Organization for Economic Cooperation and Development. So they set the testing guidelines as to how the tests are conducted. If you've seen some of the news articles that come out, a lot of times you'll notice they have these third party or kind of fringe organizations that make a lot of claims, and sometimes you'll notice they have very questionable testing methods, such as low sample sizes, or they won't disclose how the methods were even conducted in the first place. So if you see articles like that, one of the first things you want to look for are those little red flags, what information is missing. So when we look at risk assessments, first, we're going to determine if it's a toxin at all. So this is the hazard identification. Next, we're going to identify how much is harmful. Remember, the dose makes the poison. So this is where that dose response assessment comes in. There's been a lot of claims that certain foods have toxins in them. Yes, they can have toxins in them. They can have toxins in them naturally, but it doesn't mean that those toxins are going to be harmful at that particular level, and it doesn't mean that they're going to accumulate within the body. A lot of them just kind of get flushed out in the urine. So, how much is going to be harmful? Next, we look at who's exposed and how. So, if you look at, there's this one app called Yuka, and they label a lot of ingredients as toxic. But it's not that the ingredients are toxic in food, for example. One ingredient in Cheerios that was identified was trisodium phosphate. This is perfectly safe to consume in your food. However, in its powdered form, if you're working in an industry where you're transporting that, that powdered form can get into your lungs. And that's where it becomes a problem, is if it's inhaled. So knowing who is at risk, which would be those people handling the powdered substance, we can identify safety measures that can prevent that harm from happening, such as those employees wearing masks when they're transporting it, perhaps packaging the product in a certain way that that powder doesn't go all over the place. So this is what's called exposure assessment. Finally, we look at what the actual risk is. So this is considered risk characterization. So we take all the information that we've gathered and we determine, is this legitimately harmful? How harmful is it? Okay, here's the characteristics for the risk assessment. Industrial pollution harms ecosystems and human health. Meanwhile, infectious diseases still cause millions of deaths annually, especially where there's malnutrition, poor sanitation, and limited care. Diseases like tuberculosis, malaria, influenza, dysentery, and AIDS remain persistent, and drug and insecticide resistance can complicate controls and drive a resurgence in those diseases. If we look at the case of tuberculosis in Florida in 2023, we can see there's some demographics that are more at risk. And this may have to do with certain populations who work in certain career fields more frequently, or if they are more exposed to a more harmful environment in their jobs, or maybe they can't afford housing in a more well-off area, so they can only afford it in areas that may be contaminated. So let's look at some of these. First, we notice that men are quite a bit more at risk. Non-US born citizens were more at risk. As far as age groups, we start to see an increase. There's not too many, between the ages of 0 to 4 or 15 to 14, but we start noticing an increase in teenagers. And the highest range is 25 to 44. So this is the main working class who's kind of working those starter jobs where you don't get to work in the nice offices, and you're probably working out in some harsher conditions than someone in the 45 to 64 range who may have been promoted and isn't working in those harsh environments quite as much, but they're still pretty at risk. And then by 65, many of those people retire, and they kind of get out of that line of work. So we start to see another decline. As far as ethnicities, we notice that minority populations such as Hispanics and Black African Americans, they're more at risk. And this, again, could have to do with like housing, historic redlining laws still kind of have an effect. And, you might have, groups of Hispanic people tend to live closer to each other. There's more communication and support when there's people that are in similar situations. So that could have something to do with those increases. And then we have diabetes. That's one of the major risk factors. But along with that, we also have excessive alcohol use, HIV co-infection, homelessness, illicit drug use. All of these things will increase the likelihood of contracting tuberculosis, and it increases the symptoms. And finally, drug resistance. So we have the first one is isolated drugs, so only one type of drug. And then the second one is multi-drug resistance. So basically, you have some organisms that might develop a resistance to a single drug, or some that might develop that resistance to multiples. So the ones that develop resistance to multiple drugs are going to be more harmful because there's less, you have less of an artillery to fight them. Next, we're going to look at a case study for chemical agents. Heavy metals and pesticides can build up in organisms over time through bioaccumulation, and they can increase in concentrations as they move up food webs through biomagnification. This process leads to long-term tissue burdens in many species. For example, that mercury that can accumulate in fish tissue, and lead can become stored in bones. The pesticide DDT is very well known because it persists in the environment, and it biomagnified in food webs and caused the severe eggshell thinning in raptors such as the bald eagle. This particular bald eagle, the photo was actually taken on top of the UP building here at the Seminole campus. So we do have bald eagles here, and it's partially due to policy changes. After DDT was banned in 1972, bald eagle populations began to recover. And this demonstrates that strong environmental policy can actually reverse those ecological damages. So we talk a lot about problems that exist in the environment, and unfortunately, there's not enough recognition for the progress or the reversal of these. So it's really important every once in a while, among the doom and gloom, I recommend just going out and seeing what environmental success stories are happening in the world, because there are a lot of them, and they do get overshadowed by those more depressing ones. Looking at modern hazards versus traditional hazards. Modern hazards like air pollution tend to arise with industrialization and fast urban growth. Traditional hazards such as unsafe water, poor sanitation, and indoor smoke still affect many low-income countries and communities. Some places experience both kinds of risks at the same time, which increases the overall disease burden. So the big picture here is the environmental health problems can differ depending on community. So you're not going to be able to treat an urban area the same as you would a rural area. But inequality makes the impact of those types of problems worse. So equally, you're not going to be able to treat a wealthy community the same that you would an impoverished community. So each area that you look at is going to have its own unique concentration of characteristics. And that could mean the demographic, that could mean the ecosystems around them, it could mean the pollutants that impact them. So it's important to look at the overall area and take into consideration those needs. This graph shows different regions and the disease burden from traditional and modern environmental risks from those different regions. You'll notice that the sub-Saharan African, India, Asia and Pacific, Middle East, and China, and even Latin America have more disease burdens from traditional environmental risks, whereas Central and Eastern Europe and other industrialized countries have more of a disease burden from modern environmental risks. So there is a major difference in the needs of these specific areas. And it's a good example of how we need to assess those and approach those needs differently. Looking at some worldwide statistics, 1.1 billion people lack access to safe drinking water. Poor sanitation causes 5.4 billion cases of diarrhea worldwide and 1.6 million deaths. Indoor pollutants cause 1.6 million deaths each year and 2.7% of diseases. Malaria causes 200 million infections and 430,000 deaths each year. Additionally, infections of pregnant women result in 60% fetal death rates. 2.6 billion, but without adequate sanitation. Intestinal worms from poor sanitation affect 90% of children in developing nations. And 50% of deaths from indoor solid fuel use are children under 5 years old. Think about those. There's a lot of opportunity for progress. And there's a lot of innovation that can take place to solve these problems. Global travel and connectivity can accelerate the spread of disease. Even local outbreaks can create international risks within hours, which is why surveillance and rapid response are so important. It's also important to educate ourselves about what situations might be going on in the countries or regions that we travel in. So we're going to look at a couple of cases. Obviously, we went through the COVID-19 pandemic. We saw how rapidly that spread and how rapidly it's still spreading, and it's still evolving as well. So let's take a look at the Ebola virus. In 2014, an outbreak in West Africa, it was the largest one in history. There were over 28,000 cases reported and 11,302 deaths. Some cases did pop up in Nigeria, Mali, and Senegal, but because of rapid response, those cases were quickly contained, and it prevented the spread of the virus. So if we have appropriate monitoring and appropriate response, we can prevent a lot of deaths from occurring. Now, AIDS is a little bit different. Since its emergence, it's infected more than 60 million people worldwide. Over 20 million people have died, and the epidemic continues to spread rapidly, with about 14,000 new infections daily. More than half of those are people under 25. Over 95% of the people living with HIV and AIDS are in low-income and middle-income countries. In sub-Saharan Africa, AIDS is the leading cause of death and reduced life expectancy by more than 10 years in most nations. We did not have a rapid response for HIV and AIDS. In fact, there was a very large delay. There was science denial. There was a lot of persecution and a lot of myths that were spread and some to this day still continue to spread about HIV and AIDS. This was not handled like it should have been. It was not handled with the appropriate response as the Ebola virus. And today it's still a very controversial issue. Protective measures are still being denied by some different groups and organizations. A lot of false information is being spread about it. This is an example of how things went wrong. And the reason that it still continues today is because of that delayed response. So, this has prompted the World Health Organization to issue travel-related health precautions to prevent global outbreaks. So it's a good place or good resource to look for if you're planning on traveling. If there are outbreaks in an area, you can change your travel arrangements in accordance with what's going on in that area. You can make your best judgment call, but notifying people and people educating themselves is an important part of containing these types of diseases. Moving on to environmental contamination. Humans can be exposed to environmental toxins in several ways: by breathing them in, by absorbing them through the skin or eyes, or by ingesting them either directly in food and water or indirectly through hand-to-mouth transfer. These substances fall into 5 different categories. Carcinogens are chemicals that increase the risk of cancer. Teratogens interfere with the normal embryo or fetal development. Mutagens change DNA and can lead to long-term genetic damage. Neurotoxicants harm the brain and nervous system, affecting memory, movement, and learning. And endocrine disruptors mimic or block hormones, altering growth, reproduction, metabolism, and mood. Knowing which categories a toxicant belongs to can help scientists and health professionals anticipate which organs or systems are most at risk, identify which life stages are especially vulnerable, such as pregnancy, infancy, or adolescence, and choose the right kind of test to evaluate harm. This classification also guides public health decisions, such as setting exposure limits, improving safety guidelines, and designing interventions to reduce the risk. In Florida, mercury in certain fish species can pose neurodevelopmental risks, especially in pregnant people and children. State guidelines provide species specific consumption advice, and we can see that in this particular image from the Florida Health Department. There's a list of different like best options, basically. We have the low in mercury, highest in healthy fats. So these are recommended ones, including anchovies, herring, mackerel, rainbow trout, salmon, sardines, shad, and whitefish. We have a column that has the lowest mercury level, which they suggest no more than 4 servings per month. These include catfish, clams, cod, crab, flatfish, such as flounder, placid, and sole, haddock, herring, mackerel, mullet, oysters, pollock, rainbow trout, salmon, sardines, scallops, shrimp, squid, tilapia, tuna, and whitefish. Moderate mercury levels are found in bass, carp, grouper, halibut, lobster, mahi-mahi, perch, pompano, sablefish, sea trout, snapper, Spanish mackerel, tilefish, tuna, and white croaker. It's recommended no more than 2 servings of these types of fish per month. And high mercury levels that are not recommended are striped bass, bluefish, Chilean sea bass, golden snapper, jack, king mackerel, marlin, orange roughy, sea lamprey, shark, Spanish mackerel, swordfish, tilefish from Gulf of Mexico, tuna, and walleye. So you'll notice that some of these are listed for moderate and high mercury, but they're found in different regions. So it's always a good idea to check which region your particular fish that you're purchasing come from if you do eat fish. Next, let's take a look at some common substances, effects, and their sources. Arsenic is found in water contamination and industry. It can cause skin lesions, cancer, cardiovascular, and neurological effects. Mercury is found in industrial emissions and large predator species of fish. It damages the nervous system and kidneys. Lead is found in old paint, pipes, and soil and can harm developing brains. Formaldehyde is found in building materials and smoke. It irritates the respiratory tract and is a potential cancer risk. BPA and phthalates, these are from plastics, personal care products. They cause endocrine disruptions, and they're also linked to reproductive and developmental effects. So this is just a list of a couple of the more common ones. Radiation is energy emitted by atoms. And it's invisible. We can't see it, we can't smell it, but it does come from natural sources like soil, rock, and sunlight. But it can also be man-made in things like medical x-rays or different consumer devices. Radon is a radioactive gas that comes from uranium and thorium decay. The problem with radon is it can seep through little cracks in the ground and get into homes. And this can cause long-term effects if a person is exposed to it for a long period of time. This includes lung cancer, even among non-smokers. Testing and mitigation in high radon regions are really important to make sure that the population in that area is safe and doesn't get exposed to these types of substances. If someone is suspected of being in one of these areas, there are devices that can detect radon in the house. So that is always an option for personal security. But overall, government agencies like the EPA do track radon and radiation throughout the entire country. Now that we've talked about pollution, let's talk about one of the solutions. Bioremediation uses plants, bacteria, and fungi to break down or neutralize certain pollutants. We use this in the treatment of human sewage, agricultural chemicals, and toxic metals like mercury and arsenic. For example, mercury found in pesticides and industrial waste can be transformed into less toxic forms by bacteria like Pseudomonas aeruginosa. We can use hydrocarbon degrading bacteria like Alcanivorax borgamensis to clean up oil spills, such as the Exxon Valdez and BP Gulf oil spill. This bacteria produces surfactants that solubilize the oil and convert it into CO2, which is a little bit more manageable in the environment. A few benefits of bioremediation. It tends to be more cost effective than other methods. It can reach those hard to reach areas like groundwater, and it breaks up contamination at a molecular level, unlike chemical dispersion methods that can be a little more risky for the environment. Next, we're going to look at 3 case studies. The first is here in the Tampa Bay area. If we look at this map, we can see that the areas in pink are at higher risk of sea level rise. These areas tend to be low-income communities and communities of color that are disproportionately located in those flood-prone areas. Affordable housing often sits on these low-lying areas and limits the infrastructure. This makes sea level rise and storm surges especially damaging. These events don't just threaten homes, they create serious health hazards. Floodwaters can carry sewage waste, industrial chemicals, and mold-producing moisture, which leads to respiratory illness, skin infections, and gastrointestinal diseases. Standing water can increase mosquito-borne illnesses because the mosquitoes will lay their eggs in that standing water. Damaged buildings will trap heat, which increases the risk of heat stress, especially for the elderly. Sorry, I'm just like recording a video thing. That's okay. When flooding happens again and again, it damages roads and knocks out power. This means people can't get medical care, can't keep medications cold. They lose access to air conditioning during dangerous heat. Flooded stores and blocked supply routes can also make it harder for families to get food, increasing food insecurity. All of these physical stresses pile up and create serious mental health impacts, especially for communities already facing displacement and financial strain. And because the hardest hit neighborhoods often have the fewest resources to recover, it becomes a clear environmental justice issue. Next, we have Flint, Michigan. In Flint, the city switched its water source but didn't use any corrosion controls. That allowed lead from old pipes to leach directly into their drinking water supply. When the government failed to act quickly, residents, especially low-income, predominantly Black neighborhoods, were exposed for months. Pediatric data and blood lead maps later showed clear spikes in children's lead levels, and we can see that in this graph on the slide. What should have been a simple infrastructure fix became a major public health emergency, and there are still problems to this day in Flint, Michigan, so they haven't fully resolved that issue yet. Finally, we have Love Canal. Love Canal was a neighborhood built on top of an old toxic chemical dump. Over time, those chemicals leached into the soil and homes, causing serious health problems, including birth defects. And we can see from this graph that that particular area had higher levels than the surrounding area. Families had to be relocated, and national attention and public outrage that followed pushed the government to act. This crisis became the driving force behind creating a Superfund program, which changed how the United States manages hazardous waste sites and strengthened the public's right to know about environmental risks in their own communities.